Here we go. The 6AX Classic Breakfast with Nat and Westo.
If I could talk to the animals.
You know what that means.
Chatting with a chimp.
Joining us on the phone this morning, our resident vet.
Yes, Dr Sian from the fabulous Lighthouse vets at Alkimos Beach, and my own personal vet. Not me, because I'm not an animal.
Well, you know.
She is the vet that I've been using for many, many years. Good morning to the best vet in the world, Sian Goodger.
Good morning, everybody. Thank you for the over-exaggerated intro again.
Trying to get discount, mate. It's not working.
Yeah, I can see that. Good morning, Westo.
Thank you. Hello.
Everyone else listening.
Who else is listening? Maybe a couple of your nurses?
The best nurse in the world, Renee, heavily hinted that she would like a shout out. So, hi, Renee. You are the best.
All right. Now, we put the question out there to our listeners if they've got any concerns about pets, and we've got a couple through. So, Rebecca is a little bit concerned about an apparent outbreak of Parvovirus in Perth. So, Beck wants to know what areas is that affecting, and is it still safe for her to take her vaccinated dog to the park?
The reports are that Shenton Park Rescue has been treating 3 cases, I believe, but one was in the area of Mosbourne Park, so the actual affected dog was in the community. That does bring the risk a lot higher, I think. That server in particular, but also dogs and owners travel quite a lot. And unfortunately, with most viral infections, they'll be carrying it before showing symptoms. So absolutely now is a good time to check your dog's vaccination status, and if they are slightly over or due, then I would be vaccinating them.
All right.
Vaccine has got really, really good efficacy. So if they're vaccinated, they're not entirely 100% protected, but they should have much, much better immunity than an overdue dog.
Now, obviously, with Parvo, correct me if I'm wrong, it sort of does hang around for a while through the feces. Is that correct? And it can stay in the ground for a certain amount of months/years?
Yeah, it can stay and live in the soil for a long time. And we actually tend to see parvovirus outbreaks emerge in winter after rain, in this region anyway. Up north, it's much, much more common, you know, in the Kimberley regions and so on. So if you do win that trip, don't take your dog with you.
Right.
Down here, we do see some more isolated outbreaks, but the most recent ones were towards the end of June. I haven't heard of any since.
Got another one for you from Craig, who has an elderly male cat who's 15, still lively on thyroid medication, special low-protein diet. He constantly meows for more food, wants to keep eating. Is there anything that they can feed him as other than his special diet? He only gets a treat now and then. They just want to know that his meowing isn't because he's hungry.
Yeah, that's a tough one because hypothyroidism in cats is quite a complex disease. Meowing for food could be a sign of poor control. So the first thing to do is make sure that the meds are correct. The second thing would be to rule out other issues in an elderly cat, things like diabetes or gut absorption issues, so he's not absorbing the nutrients that he's getting fed, but also cognitive decline, so dementia and Alzheimer's-like syndrome can be seen in cats, and they're constantly meowing due to them potentially forgetting that they've eaten. I think it sort of depends on if the cat is overweight or underweight or completely normal. There can be some deficiencies, particularly vitamin B12 can cause an increase in gastrointestinal signs as well. So there could be lots of things going on with that little kitty. Probably I would get him checked out with a quick blood test from the vets and make sure there's nothing else going on. And if there isn't, if he's particularly overweight, Dr. Linda Fleeman, who's one of the best diabetes experts in Australia, she recommends feeding grated zucchini to shut them up. Very few calories, it hydrates them, and it doesn't interact with anything else.
Is a cat going to eat zucchini though?
My mum tried it with her cat and she ate it. She's a similar cat and she's got hypothyroidism, and she's constantly bugging my mum to be fed, but then will eat a few mouthfuls and then wander off.
Right.
So I think she's more on the cognitive decline, forgetfulness spectrum.
Grated zucchini, there you go.
Well, we'll see.
We've got a question from Gay, one of our listeners. I know that I've had dogs that have had anal gland problems before. You have to go into the vets if you're not skilled enough yourself to get them drained, so to speak. And you've done it quite a few times for my dogs. Gay wants to know if you would recommend anal gland removal for dogs that do have those blockage issues.
Yeah, I think it depends. So the anal gland isn't an essential part of the dog's anatomy. It's a little sac that sits there and secretes scent, and it's for marking in the wild when they were territorial wolves and wild dogs. So you can remove it. The surgery is best done with an experienced surgeon because although you can remove the anal glands with absolutely no consequence to the animal, if you stuff up the surgery, there's quite significant issues with potentially some fecal incontinence, which nobody wants.
Nobody wants that.
And so the decision to remove the anal glands does need to be carefully assessed. I think if they're constantly getting infected, then perhaps a better treatment can be to instill medication directly into the anal gland. We call that anal gland packing, and that can resolve recurrent infections because antibiotics given orally and anti-inflammatories often don't penetrate the area particularly well. Again, if they've had burst anal glands in the past, the surgery can be a little bit more tricky because of the scarring in that area.
Right.
So learning to express them yourself can be an option. I don't have many owners take me up on that.
It's a firm no from me.
I finally know what that Madonna song's about. Express yourself.
I think it's an anatomy issue a lot of the time. Lots of these dogs have itchy skin as well, and so allergy management can help. But every patient is different, and there's lots of factors to consider, I think, before going for surgery. But there's no reason not to.
Would you also recommend any of those, the treats that you can get? I think Dr. Chris has got one, and you can buy them, and they're supposed to actually push things through. Does any of that stuff work, or like giving them pumpkin and stuff?
I don't want to publicly go against Dr. Chris.
Oh, gosh, heavens, no. He's a friend of the show.
He's far too good looking. I think I haven't personally had much success. Basically, the theory behind those is to help bulk up the feces and firm up the feces so that the anal glands express, automatically when the animal does a poop.
Yep.
But that isn't always successful. So there's lots of other ways to firm up the feces. So I really like psyllium husk.
Okay.
Adding a teaspoon or a tablespoon per day to the animal's food, that does tend to firm up the stools quite a bit.
Yeah.
And it's got lots of other benefits with, supporting the gut microflora.
Yeah.
Personally, I haven't had a huge amount of sex. My own dog has problems with anal glands as well, and she doesn't respond to supplements, so we just express her.
Same,
as well.
Likewise. But just like humans, I might start eating a bit of psyllium husk just to get things moving.
You can't go wrong with it.
Yeah, you really can't on your top of your all brand.
Well, we got one from David.
Got a male Maltese. He's got old, and now he's decided to urinate in the house.
Oh, dear.
Yeah, it's been a problem.
Yeah, that would be a problem. So an old dog who's just started weeing in the house, Sian.
All right, so I've got a personal question for this dog. Does he still have his testicles? So there's many different things that can cause urination in the house. The health factors would be a urinary tract infection, kidney disease, prostatic disease. There's also some hormonal imbalances like Cushing's disease, where they're drinking a lot and peeing a lot, and diabetes, obviously.
Yep.
So the first thing to do, I think, is to have a quick vet check and take a urine sample in.
Yep.
We want to take a freshly collected urine sample. I like an old soup ladle to scoop underneath.
Nice. Sanitize that before you use it for your pea and ham.
You can dish out your husband's dinner, whichever you prefer. I get a lot of questions about how the heck do you catch urine from a dog, so that's quite a good trick. And we want to test the sample within a couple of hours because it can change the results if it's sitting around for a while. If we've ruled out health issues, it can be behavioural. So if it's very cold and wet outside, some dogs just don't want to get their paws wet. Again, going back to the cognitive decline, there is some dementia signs that can cause inappropriate urination. I think everyone's got an old male relative that's peed in the wardrobe before. Or it might be just me.
I think it might just be on your own there, Sian.
Who knows? Sorry,
I've got an elderly mum, but there's once or twice we've had an accident, but other than that.
And also some functional issues. The sphincter strength, as everybody ages, becomes a little bit weaker, not able to hold on to a full bladder.
Yeah, especially if you're doing star jumps.
Yeah, don't bounce on a trampoline, let's just say that. And the other thing is they can be a bit sore. So lots of dogs, when they're old, they don't want to get up frequently. So they'll sort of lie around until they're absolutely busting to go for a wee, and then they can't potentially quite make it out in time. So there's that as well.
Fantastic advice yet again from the best vet in the world, Dr Sian Goodger from Lighthouse Vets in Alkimos Beach. Thank you so much for joining us.
My pleasure.
I hope this was as much fun for you as it was for me.
The Classic Breakfast with Nat and Westo. Weekday mornings from 5:30 on 6AX.
I'm done. Stick a fork in me.